everyone. Welcome to the podcast. I'm your host, Dr. Dean Mitchell. Grab a seat, get comfortable. You're about to enter the smartest doctor in the room. Today, I have back on the podcast for the second time a very special guest. Now, actually, almost all of my guests are very special, truly. I handpick them. They are not paid to come on. But today's guest, honestly, is a little bit extra special to me. He's Dr. Neil Nathan. He's someone that I look up to as a physician, a teacher, a mentor, and he's really a true leader in this field of functional medicine. Dr. Nathan has a new book out. It's called The Sensitive Patient's Guide to Healing. And like all of Dr. Nathan's books that I've read, and he's done many, it is extremely readable for either a patient or a physician. And I've said this, and I was thinking about this before, he really threads the needle. I mean, it's not easy to appeal to both doctors and patients because each of them obviously have different backgrounds. But his style of writing is very conversational. It's not didactic. You know, when I first knew we could do this podcast, and I, in a panic, wanted to get the book to read before interviewing him. And then I saw, first of all, I think it was like 400 pages. I'm like, oh my God. And then I started to think, Dean, in medical school, you had to read Harrison's, internal medicine. And trust me, that was very dry and painful. But I said, I know Dr. Nathan, so maybe it can't be too bad. And I was able to get a copy, and I power read through it this past week. And I have to tell you, I just enjoyed it. And I know it's going to have a place on my shelf of special books that I'm going to refer back to. And one last point I want to make also for the listeners, because the kind of podcast that we do here, my background's in immunology, internal medicine, infectious disease, all the conventional stuff. And when I made that journey over 20 years ago with my wife to get into holistic medicine, as we called it then, it was definitely a field that was maligned by, and possibly, truthfully, there were charlatans, there were quacks out there, but there were people doing really good work. And all I can tell you, if you're familiar with Dr. Neil Nathan, his work is not only credible, he's just a trusted voice in the community. So with all that praise, which he totally deserves, it's my enormous pleasure to welcome Dr. Neil Nathan to the podcast.
Yeah. Thanks, Dean. Thanks for having me.
Okay. We're going to jump right in because there's just too much stuff to not jump in.
Thanks for that intro. No pressure.
No, I told you, we put people on very high pedestals here. Okay, but let's really jump in because I was thinking, I think about these questions. Obviously, reading your book is it's really so meaty. There's so many important things, but how do we make it relatable to the public? But the first thing I want to jump in on is the chicken or the egg. And what I mean by that is, are people just born sensitive to medicines and the environment of foods? Or would you say a majority of them, in your experience, it's because of some of the factors that you mentioned in your book? Because as you know, I know patients, I see them all the time. I know family members like, oh, I can't take that medicine. Oh, I can't take that supplement. I'm too sensitive. So
the answer is both.
Okay.
Some people are born sensitive, and more people acquire sensitivity by the way their life plays out for them. Now, you can understand why it's both if we understand what triggers sensitivity in the nervous system. So when we're talking about sensitivity, we're talking about something that your senses pick up. So we're talking light, sound, touch, smell, chemicals, EMFs, food. If you become sensitive to anything, your nervous system is a part of that deal. And there are two main parts of the nervous system that relate to sensitivity. There's the limbic system, and then there's what we call the vagal nerve system. These are two different parts of the brain, but they communicate together intimately. Their job is to protect us. And the way they protect us is they put their sensitization antenna out there looking for anything in the environment that they think might be a threat to you. So they're trying to protect you. That's what they're trying to do. And they will give you a warning signal based on the kind of neurology and neurological issue we're talking about, that to get your attention so that literally it's, hey, you can't do that. And I'm going to inform you of that by giving you symptoms to wake you up to the fact that this is not safe for you. Or more importantly, we don't think this is safe for you. So these systems can become what we call hypervigilant, meaning after a while, they can become so overprotective that you start reacting to things that really you might be able to take. So we are all born with different senses and skills related to those senses. For example, there are people who are born with a refined sense of taste. They may become a chef or a food critic or something like that. Or we have sommeliers, people who have an exquisite nose for wine, and they
Right.
can discern subtleties that I can't discern. And we have people with an acute ear, so that musicians, for example, can hear subtleties in sound that other people's can't. And painters can see different subtleties in light that they can paint that other people can't. So are we born with some of those gifts and I'll call them predispositions? Yes, we are. But in terms of what makes us worse as we get older, those are gifts that people can use, they can be functional. But for the people we're talking about, what this book is written for, is those people who have become so sensitive to light and sound and touch and smell that they've become literally disabled. They may not be able to leave their home. They may
Right.
not be able to take the medications and supplements that we know will help heal them because they're so sensitive that their body won't allow them to do that.
I know
So
we both have had, I mean, obviously you've had hundreds, thousands of patients like this, in the last 5 years when I started specializing and working with you on the mold. I mean, it's devastating, devastating. Some of these, as we'll get into, these chemically sensitive patients. I mean, I had this one woman, unfortunately, she passed away this last year. She was in her 60s and she couldn't leave her house because if the smells from the neighbors' things, she would lose urinary continence. So she couldn't even go anywhere. I mean, it was just, and like you're saying, and I'm sure, some of our patients can relate to this. All the things I would try to prescribe for her, from the safest things to whatever, I can't take that, and as you know, doctors get very frustrated. They get sometimes, unfortunately, angry at their patients. Like, what do you mean you can't take that? Anybody could take that, and I know, your way, you put patients to, get them at ease very easily. But it's something that I think that's the point of this podcast today, that patients shouldn't realize they're not crazy and they're not alone. And they do need to find a doctor that will be sympathetic and have the tools to get them better. I wanted to ask, one other thing I wanted to point out, because I was, again, thinking about this connection too, and for the listeners, years ago, I read a book by Susan Cain called Quiet. And Susan, was interesting. She was a lawyer who turned writer and became very popular. And the book was it's very interesting. It was about introverts versus extroverts. And I didn't know. It's funny. I was reading the book, and like every page I was turning was like reading my life. Like, where I preferred a lot of times to be alone reading. I didn't like big parties. My wife would get upset at me. Like, what do you mean? We're going to this wedding. You got to socialize with people. I'm like, I don't like, I like one-on-one. I don't like, we're bouncing around from one person to the next and things like that. And she described all that in her book. But the reason I'm bringing it up was because she annotated in the book, there was a researcher, I forgot who, that basically showed people that tend to be introverts have a more either larger or more hyperactive amygdala. And I thought that was fascinating because, again, when I've done work with you with patients, and what you're just saying now is that, when you say genetically or whatever, some of us are just more born, with different, anatomy and whatever we want to call it, neurochemistry. And I think the answer is, okay, not to hopefully be in a bubble, but put yourself in the best environment that you could have the best quality of life.
I want to suggest that may not just be born with a bigger amygdala, but acquire a bigger amygdala by the events of your life.
Yeah.
So another word for introvert versus extrovert is most people who are introverts are also empaths. They're exquisitely sensitive to
Mm,
what other people are feeling. And
mm,
part of what makes them become an introvert is because their sensitivity is such that they can't handle being in a room in which there is so much incoming stimuli
right,
that it's like overwhelming.
right, right.
I want to add that introverts are empaths, and empaths have the gift of being able to relate to people really well because they can actually feel what other people are
Mm,
feeling.
mm,
But many empaths haven't recognized the liability of that gift, which is you are subject to taking on what other people are feeling and thinking it's yours if you don't ask, forgive me, this very simple question: whose feelings are these? And I've worked with empaths for years and have tried to teach them very simple. If whatever you're feeling, ask, whose feelings are these? Might sound like a
mm,
silly question, but it's
mm-hmm,
not, because the very gift of the empath is that, oh, wait a minute. If I were having chest pain, it wouldn't feel like that. This is not my chest pain. Or if I were sad or depressed or down, which I have been occasionally in my life, that isn't how it manifests in me.
mm-hmm.
So
Interesting. Wow.
whatever I'm picking up, that's
Mm-hmm,
not mine. And as
mm-hmm.
soon as you recognize it's not yours, you can let it go.
Wow.
But I will say what you're describing is people who are introverts or empaths don't always want to be in a crowded room with people because they'll be picking up some things with people that is unpleasant. It's not even theirs. So it's a protective mechanism to go, I'll just have dinner with these two people and just we'll have a nice little dinner. And
Right,
I don't want to be at a table of 26 where we're
right.
tossing things around and I don't know what's going on and the energies are. So I wanted to add that piece,
That's important. Really
but I
important.
want but I want to go back in time to expand that because this does involve the amygdala, which is another
Yeah.
word for limbic
Right.
system.
That's what I want the listeners to realize. Yes. So
Right.
they can, they can look it up and look at a picture of the brain. Like you do so nicely in the book, because I think it's important even for myself to remember what are we considering the limbic system. That's a little bit technical. We'll call it sometimes the reptilian brain, meaning, the very primitive brain and parts, that you mentioned in there, like something called the insula, the amygdala, the hippocampus, versus we'll get later to the vagus nerve, which is part of the cranial nerves. This is a little technical for the listeners, but again, I think in your book, you do a really nice job of explaining that, and letting the pictures help as well.
So to make it simple, there's really two parts of the brain that are their job is to protect us by monitoring our environment for safety. The vagal system and the limbic system, which we've been talking about. And the limbic system is refined from the time we are a fetus in our mother's uterus to throughout our whole life. So no matter how small we are picking up perceptions of safety
Right.
so that none of us have had perfect childhoods. So throughout childhood, if you happen to have been a kid who had multiple ear infections and throat infections and took a lot of antibiotics, if you, for some reason, needed surgery for something, or if on the emotional end of it, if you had distant parents who didn't share or talk much, or you had abusive family members who were either physically, sexually, or emotionally abusive, or any of these things shape your way of seeing the world. Is it a safe place? Is it not a particularly safe place? And to whatever extent you think it's got some degree of threat or danger, the limbic system slowly and inexorably becomes more and more hypervigilant to protect you. So by the time your life evolves, I will call the kinds of things that will trigger particularly um, limbic and vagal dysfunction and make people sensitive. The most important ones are mold toxicity and Lyme disease. There are others, but those are the straw that breaks the camel's back. You
Yeah.
have a system that's being sensitized, and then you get a toxin in your body or an infection that actually structurally inflames the limbic and vagal systems, and now we are off to the races.
Yeah.
So, and I want to emphasize This is not psychological. This is neurological. This is being wired to be protected. And so when we get to talking about treatment, we can treat this. We can reboot the limbic
Right.
system.
Right.
Not
Well,
like
that's what's unbelievable to
right.
believe. I have to interject this. When we've done the dual consults together, and I'm being honest, and again, I've known you for a while and read your work. I was like, you would sometimes start off with some of our very complex patients about this, and I'm like, why is he talking about this now? I mean, they want to get to the juicy stuff, like what supplements and this and that. But obviously, over repeated consults with you, it started to really ingrain with me. I've done meditation work. I haven't done, we'll get into later, the Andy Hopper work or the Ashok Gupta, but, which I plan to do. But I was like, I know this is important, but he really is spending a lot of time on this. And then it really hit me, I think, when I was reading the book, again, this time also, and not only reading the book, but when I go in, I'm with patients every week, like, without fail, every week there'll be a patient that I'm like, I don't see how I'm going to get through to this patient. I know what to do to help her or him, but they are in such a high state of alarm. They're in that hyper fight or flight mode that anything that you suggest, they're against, because their body, like, they're in such an unsafe place. I almost wish sometimes I tease, sometimes the patients, I wish they were like a possum and they just like, I'll do whatever you say, because it's kind of the opposite. But I want for the listeners to really appreciate, because it's almost like you can't, because when you're going through yourself, you're just in this hyper state. But as a doctor, I see this, and I know that I may know, like you're mentioning about with mold and Lyme, that we can treat that, but we can't get through unless we calm down their brain.
And that's exactly true.
Yeah, and we're going to get to this later on. So please stay tuned here. We're going to tell you how to help your brain, which, it's just, look, it's the field of psychoneuroimmunology, and it's what's taken, I believe, holistic medicine from, again, the quackery and the charlatans to people doing real work, that how it's so integrated. And when a lot of our patients who feel failed by the conventional system, when they see a gastroenterologist, he's just dealing with their stomach. They go to see the ophthalmologist, he's just looking at their eyes and not putting this all together. Okay. You mentioned, so I think we should hit on this too. You talk about in the book, for sure, the big three: mold, Lyme, and Bartonella. And I have a great case for you coming up. A guy that's a gardener that we have to help.
Be still my heart.
Yeah, it was really. I tell you, even the blood testing was so dramatically positive that I think you'll get excited about this. But maybe you can explain a little bit too, because again, you're really such an expert in this area. Why these particular three grab your attention out of so many other things, and I guess why is it doing such a number on the on people who are sensitive, maybe people who weren't sensitive before?
This centers around inflammation, so that what happens is, even though Lyme and Bartonella are infections and mold toxicity is a toxin, and people could go, well, why would those have similar symptoms, or why would they affect the body in the same way? And I'm going to toss out one other biggie in here, which is COVID, which is, why do all three of these things look so similar? Yeah. And all three of them will affect the body in profound ways. They're systemic, meaning they don't just give like one symptom in one part of the body. They affect the whole body. Right. Differently in different people, because we have different biochemistries and different genetics, but any of them can cause fatigue, cognitive impairment, anxiety, depression, neurological symptoms, gastrointestinal symptoms, allergy symptoms, autoimmunity, headaches, joint pain, muscle pain, you name it. So almost any symptom you can think of can be triggered by these inflammatory materials. So what they have in common is that they're the most common things that I know of, Dean, that will trigger this type of an inflammatory condition. And they're some of the most common things that most of my medical colleagues they're not on their radar.
Yeah.
It's
Yeah.
not,
It's
they're
not
not,
taught in conventional practices. I just have to throw
oh,
this in.
yeah,
When my chief of medicine, when I was trained in New York City, he was a very famous infectious disease allergist, immunologist. And he was very old school. And as much as he was into infectious diseases, he used to say, I'll never see a patient that has 10 or more symptoms. And like the other doctors would laugh. And I'm like, what is he?
okay, well, our patients, what we're talking about,
Yeah.
have 40 or more
I
symptoms.
know. So I said, like, it's overwhelming again to the doctors and the poor patients. And the
Well,
thing to me that makes me laugh is that syphilis, that some of these doctors, or tuberculosis, they used to call them the great mimics because they had 20 different symptoms. So why all of a sudden now, just because you can't find an organism, it's harder to find that
right.
you're basically dismissing these patients.
But you could if you were looking for it or if you knew where to look.
Yeah,
And
right. I agree.
that's
Yeah.
unfortunate. So there are some doctors who believe that there is no such thing as chronic Lyme disease.
Hmm.
There are some people who even question about acute Lyme disease. And the CDC, in its infinite wisdom, has now acknowledged that there are 675,000 new cases of Lyme every year. This
Mm.
is an epidemic infinitely greater than HIV ever was.
Wow.
It is estimated that there are 10 million Americans right now suffering to some degree from mold toxicity. And yet, and it's always been my job, or I think of my job, to help educate physicians and educate patients that the things that we're talking about are not only real, but they're common and they're treatable. So it's to answer your question, what triggers all of this is inflammation. That the inflammation from mold toxins, the inflammation from the toxins and infections produced by Lyme and Bartonella, and the profound inflammation triggered by COVID, they all affect these different parts of the brain, the vagal system and the limbic slash amygdala system, to create this type of sensitivity. And so I appreciate your candor in saying, why is Neil spending half of this time, half of this hour consult on trying to tell this patient about limbic, vagal, and mast cell issues? The patient's got mold toxicity. Tell him how to treat the mold.
Exactly. But again, and that's part of my thing. As I said, I haven't, which I keep on kicking myself. I have to make the time to do we'll discuss a little bit, those Ashok Gupta, the Annie Hopper, because again, I'm sure when I go through, because I've had a couple of patients that have listened to you and done it, and they feel that it's helping. It's part of the program. It's almost like telling people, you had a surgery and, we're going to get your knee better, whatever, too, but you got to do the physical therapy. You got to do the whole package to get the
Yeah.
full benefit.
Here's the deal. The body will not let you heal until it feels safer.
I know.
I'm going
That's
to
a
say it
big,
again
yeah.
because it's critical.
It's so
It
important.
won't let you heal. So you could be doing all kinds of tests on patients, and you can determine that their mitochondria aren't working well, or that their methylation is deficient, or that they
Hmm.
are deficient in zinc and magnesium. And you can give them treatments for that, and they don't respond because they're from their perception, on their body's perception. It's not in their head. This is not conscious. They're on survival mode, and their body is basically going, "Hey, I'm on survival mode. That magnesium or zinc you're trying to give me, that's nice, but I got bigger fish to fry here. I have to get safer. You have to help me to feel safer, and then I will be able to respond to that." So with the patients we've consulted on, the reason I started back there was because from their history, they had already become so sensitive, they had already become so reactive, and you're with me in this, that they couldn't take the teeniest bit of clay or charcoal to start getting the mold out.
Right.
And when someone tells me that, what they're telling me is, I'm on survival mode. I need to get off survival mode, then I'll be able to respond well. So, and again, Dean, I wrote this book, Sensitive Patients Healing Guide, to help all of those folks out there who've been told by physicians, family, you name it, that you're too sensitive. Toughen up,
Yeah.
get stronger,
Right.
be a man, be a woman, whatever it is you've been told to do. And that is simply horrible advice because that's not what's at stake here. It's not about being tougher. It's about healing the systems that have become too sensitive. And we have the beauty is, and that's why I wrote the book, is in the last 20 years, we've learned a tremendous amount about what is about understanding how the body becomes sensitive. And even more important, we now know how to treat it quite effectively.
Yeah,
So,
that segues perfectly into what I wanted to get into, which again is hard for patients. I think it's hard for doctors to truly believe, but you mentioned in the book, and it's so important, two terms really, brain retraining and the fancy medical term for neuroplasticity. So if you could explain a little bit to a patient who says, God, I can't take anything. I'm so afraid it's going to make me worse. And you, again, you and I will notice this. And so maybe you could do a little bit of a brief explanation of how, the best ways you think about brain retraining and neuroplasticity to help a patient set the stage for getting better.
yeah, absolutely. So, as soon as a patient tells me, I bring up a supplement or something, and they'll say, "Oh, I'm so sensitive. I'm not sure I could take that." Once they begin to understand, we give them a little talk about the limbic system, what it is, and what I literally can tell them is, what you just said to me is your limbic system talking. It's not you as a being. It's your limbic system is telling you, I don't know if that's safe, and I'm not sure I'm going to let you do it. And the first way I'm going to not let you do it is I'm going to make you afraid because you have reacted. This is reality. You have reacted to a number of supplements over the period of time. Not this one, but now I'm gun shy. I've reacted to so many. So it's a way of conveying to the patient, this is your limbic system talking, so we need to reboot it. Whether we use the word rebooting or neuroplasticity, we can tie into the brain's innate way of healing. And the brain can heal this there are several programs that have been developed over many years by some experts in this field. Annie Hopper is one. She had developed a program called Dynamic Neural Retraining, and Ashok Gupta is another. He developed a program called Amygdala Retraining. Again, that's the same thing. More recently, there's a woman named Kathleen King who developed a program called Primal Trust, which borrows a little bit from both and adds some of her own material to it. But literally, patients can go online and begin this process. All of those folks have an educational component so that they try to teach you what is the limbic system, why is it so important, why do we need to reboot it, and then they go into the actual rebooting process. And that differs between the different folks here. Annie Hopper's program is more where she's taken some of the most recent research on neuroplasticity and has patients say certain words and phrases using gestures and movements repeatedly that ultimately, literally reboot the limbic system. It changes the way the neurons in the limbic system fire. If someone has a fearful thought, they're saying something fearful, that reinforces the negative part in the limbic system. If you recognize that and you change the language to positivity at every level, that changes that neurological signal to one that can literally reboot the symptom. Ashok Gupta does it differently. He has what he calls meditations, but are more correctly guided visualizations. And just by the way, Dean, if you write to Annie or Ashok and tell them that I told you so, they will send you that program for free so that you can
I need
do
to
it.
go through it. I always, that was the other little question. I have to just interject this here. Your book, with all of its chapters, I mean, and it is really going to be a classic in the field of functional medicine. There's just no question about it. But I have to ask you this, because I know even my own practice, like a lot of times I try a lot of things. Obviously, I don't want to have every illness that my patients have, but I try a lot of the stuff. Did you pretty much do all of these things that you mentioned in the book? I mean,
Yes.
You have. Because I got the feeling that you did. You just knew it so intimately, but there's a lot. I mean, there could have been 20 editors to your book. It's
Right.
just you.
Right. Well, I had 20 of the most prominent clinicians in this field write chapters.
I know, but you still edited all of them, or you were part of that.
I was. In fact, I co-wrote many of the
I
chapters.
saw. I know. I mean, it's really it's a Olympian size task.
Well, I've always been in my practice, whenever possible, I always wanted to do whatever treatments I'm recommending
I know.
so
Yeah.
that I could really explain to people what it does from the inside.
Yeah.
So
No.
yes,
No.
I've done the Asha Gupta program, I've done Annie's program, to and I and I'm going to go and encourage. I know we're busy, but both of them have offered that any physicians that I say
Oh,
they'll send it to you.
no, I
So
definitely would like to do it. It's definitely it's a project that, yes, as I said, I've done meditation training with John Kabat-Zinn and Dean Ornish, and really, I mean, it lasted a lifetime. And when and I'm going to get to this really important point actually, because when doctors believe in something, I think and if they have that good relationship with the patient believes it. So if I sit down and, for example, a lot of my asthmatics, I'll teach them breathing techniques because I notice a lot of them are very restricted in the chest from over years of being tense in their breathing. And I say, look, this is how you do abdominal breathing, et cetera. And they see how emphatic and how like you are when you do your consults. They're like, this is important. Dr. Mitchell is taking the time to emphasize this. The other little twist I wanted to ask you, because this really goes to, I don't think it was really mentioned in the book, but again, knowing your clinical experience and the way you are, we both know too that the relationship between the doctor and the patient is so critical. Like, even with everything you're saying, and which is tremendous insight, if the doctor doesn't get this across as credible, believable, and safe itself, I think the patients aren't going to take to it. And I'll just say one thing too. It's kind of funny because I wonder what you think about this. Like, I remember once I was seeing a person who had special training in osteopathic manipulation, and I was going to him because I had a medical or back problem. And I remember being in a bad place at the time, probably from a lot of stress. And I was like, "Look, what happens if I don't get better?" It was like, again, getting to that state. And the guy said to me, which was great, I never forgot this, and I've hopefully incorporated in my practice. He goes, "Look, take all that worries and give it to me. I'm going to take care of you." And I was like, okay. And lo and behold, I started to get better a lot faster. So what's your thoughts about that? I mean, I know you really didn't put a chapter in on that, but do you feel that that is such a critical, I mean, it really takes you back to biblical times when people used to go to the, to the, not the prophets, but
the laying on of hands
laying
and
of hands
prophet.
on. People would go, and that's why people did sacrifices, get rid of the evil spirits. I know we're getting a little silly now, but there is something to that. I see. I mean, look, you and I both see too. When I have patients are tears in their office, they're like, "Oh my God, you believe me." And it makes me get a little nervous, but I also, it empowers me. They'll say, "But I really feel that you're going to help me." And then I'm like, you know what? We're on the right track. I am. We're going to do this. This is going to be the road we're going to go together. And also, I think not being alone is so huge, for patients in these journeys, especially these sensitive patients that you see.
I think so. First of all, what you're talking about is bedside manner,
Yeah.
and that can't be taught in medical school. Um, in fact, forgive me, but a lot of medical schools choose candidates for medicine that are more in their head than in their body. And I'm not sure we choose people for medical school properly, because we should be incorporating people who obviously have a big heart and compassion. Because
Right.
being good at medicine isn't just an intellectual exercise.
Right.
It's, you're saying, it's connecting people. The most important part of that is listening, where it's been documented in medical studies that the amount of time that a doctor waits before jumping in and interrupting a patient is, as they're starting to tell their story, is 7 seconds. So
Oh, even I don't interrupt that much on podcasts. Although some people have said I do. I don't know.
I'm just saying.
No, it's important.
And in this day of managed care, where a physician might have 7 minutes to deal with a patient, you can't deal with complicated stuff in 7 minutes.
Right.
So the most important part of it is for the patient to have a rapport with you is they need to feel heard.
Yeah.
And they will only feel heard when they've had a chance to tell their story, where you're with them in the room, looking at them, eye contact, not with your back to them, typing into a computer, which is, again, another horrible part of
Yeah.
our current way of practicing medicine,
Right.
but with you paying attention, listening to you, responding as one human being to another, to so that, as you're saying, I can't count the number of people who have wept or cried somewhere in our first interview where they'll just say to me, gosh, I've seen 30 docs and no one has actually listened to me. Thank you. And I'll say, I haven't done anything for you yet. And they'll say, oh, yes, you have.
Yeah, I
You
know.
know,
It's right. It's
I feel heard. So I would say the most important quality that we can bring to the table is compassionate listening, where, and when we do, then if we tell someone, I really have heard you and I think I can help you, that's really different from the message they've gotten before, which is listening for 7 seconds and saying, I'm an expert. Of course I can help you. They've learned to not trust the message from the person who tells them that they're going to help them, who hasn't listened. And that's why this is so important.
Right. And you bring up another point just came into my mind too. Like, as you know, I'm sure seeing all the Lyme patients that you've seen in Bartonella. And a lot of times patients will say, oh God, I remember getting bitten by the tick or this, but the doctor says my tests don't qualify. They don't meet the criteria or they're negative. And yet they're having all these symptoms, which from your experience are probably due to chronic Lyme. And, again, I mean, patient after patient will come in with tears saying, the doctors will tell me my tests are normal, but I am sick. And, and that is where the work really begins, making that connection.
And what's really unfortunate about it is a lot of physicians are under the mistaken impression that in order to be a good doctor, you have to have something on a piece of paper that proves the diagnosis.
Right.
But the CDC specifically says that Lyme is a clinical diagnosis.
Oh, does it? Yeah. Mm-hmm.
Because of the inaccuracy of Lyme testing.
Right.
So that Lyme is a clinical diagnosis. Whether or not you have a history of a tick bite, but if you have all of the symptoms of Lyme, even if the tests are negative, then it is good medical practice to consider treating them for a few months and seeing how they respond. And in the same way, I wanted to comment on mast cell activation.
Yeah, we got to get to that. That's important.
Which is another major sensitizing part of the body. I get so frustrated because mast cell activation has gone from being unheard of 10 years ago to now being super popular. There are clinics in every major medical center that specialize in it. And it frustrates me because those clinics invariably insist on having a positive test for mast cell activation.
I know. Right. I want to get into that in a second. But one thing before we jump to that too, one thing, because you mentioned about doctor training, and I've said this a lot, and I still teach at the medical school. And what hasn't changed, unfortunately, and I remember this all too well going through my medical training, was, you take tests. There's A, B, C, D, all the above, none of the above. The patient should only know this. This is your training, like the first 2 years of medical school. And what I sometimes say when I realize doctors are not open or thinking out of the box is because they're so used to always having an answer. You're trying to trick on these big exams and stuff like that too, that you got to know the specific test and is it A and B both a test, but you get into clinical practice and the floodgates are open. There's there's no A, B, and C, or all the above, none of the above. It's, hey, does this fit? How does this go in with what the patient's saying? And so I do think, and my other major criticism of medical or pre-medical training is that, as medical students are so competitive to get into medical school. So they're fighting to get the best grades and, not necessarily always working as a team. And I've talked about this on the podcast with some other people, but honestly, if I was to be the czar, the guru of medical training, I'd say, you know what? You should find one or two partners and be a team, and we'll accept your team into medical school, because that's what you better learn how to do. Because any doctor or practitioner that works in isolation, can't be that good. I mean, one of the things that I see you do also, again, all the time in your consults, and I think I've gotten better at it too, is if I can't help person, it's not in my expertise, steer them to the right person. They're so grateful. Because I know you mentioned all the time getting craniosacral therapy or acupuncture or whatever it is to get them better. But that only happens if your ego is not in the way to say, you know what, I need somebody that can do something that I don't know very well.
Yeah,
So I know.
absolutely. When I was in
Okay.
medical school, I had a radiologist who taught me a great lesson. He was teaching a group of us,
Yeah.
and he put an X-ray up there, and he'd say, "What does this patient have?" And we would all make, "This is pneumonia, or this is this, or this is
Right.
that," and he'd say, "This is an X-ray. This is not the patient.
Mm.
So this may give me information, but it is your patient who will tell you what they have, not this X-ray and not a piece of paper that you're generating by running blood tests." There's no test known to humankind that is so accurate that we can absolutely nail the diagnosis on that basis.
That
So
was
it's
really,
it's I don't think patients understand it. I don't even think
Mm.
doctors understand
No,
it.
they know. Everybody, it's like, do you believe what you see or do you believe what the test tells you?
I have one standard of excellence, which is my patient getting better?
Right.
I
Well,
don't care.
but Neil,
I don't care what
also,
their lab work is doing.
I
I
know, but
don't.
patients,
It's
this with the mold patients, and I see this all the time with my allergy patients. They're like, okay, when are we repeating the test to see if I got better? And I'm like, we're going to know you're going to know when you get better. Well, we said, we just hope the test reflects that. But what's more important, your test getting better or you getting better? Right. But, there is some patients that rather see the test get better.
well. I mean, this means that they're wired to not trust their bodies or their
Yes.
perceptions or their
Right.
intuition.
Yeah.
It's not bad or good. It just gives us information about that being, which
Yeah.
is I only believe what my eyes tell me, as
Yeah.
opposed to, well, what about the rest of your senses?
Yeah.
That's unfortunate, but there are many people that way.
Yeah, no, I know we're getting a little bit toward the end. One thing I want to cover with you, which is so important, again, like as you were mentioning, you've seen hundreds of thousands of these cases. I am seeing an enormous amount of these cases. And I just want to preface it with this because it's kind of interesting from my background. I know my early years, I was just doing allergy alone. That was it. And it was interesting. And we were taught that mast cells are, quote, an allergy cell. Now, I guess God decided to invent an allergy cell for some people who are unfortunate to get this cell. And, so we know that it's, IgE, which is the allergy antibody, binds to mast cells, and that's what gives you wheezing and sinus and, the whole, and food allergies. And then in the last decade, there started to surface, mainly in the functional medicine community, this mast cell activation, which is different than what's more of a hematological disorder, mastocytosis. We have too many mast cells, and it can be a very, very serious type of cancer in some cases.
Except, just want to add,
Yeah, sure.
it's so rare that I've never seen a
Yes.
case.
Oh, yeah.
Yes.
I've seen a couple because of my specialty.
Okay.
But anyway, but yeah, so the functional medicine people were kind of the ones like floating out there, this mast cell activation. So of course, first the allergy community, like, no, this doesn't exist. This is nonsense. I mean, these guys are, again, remember the charlatans, they're making up a disease so they can treat it. This is what I was hearing within my community. Dr. Lawrence Safran, who I've had on the podcast, was really one of the original people, who's actually a hematologist, who started to write about this from his experience and find markers, which was very interesting. But I thought about something, and this is what I want to get your opinion about. I started to realize, something? In the allergy community, we really missed the boat on this. So many patients that for years complained of multiple chemical sensitivities, right? They couldn't walk down an aisle. I had patients who couldn't walk down the aisle in a supermarket because the smells would set off rashes and trouble breathing. And again, all the person we talked about earlier who definitely had mast cell activation, my patient who unfortunately passed, couldn't walk out of her house without losing her urine, from the chemical smells. I mean, crazy stuff. And I started to realize how important this diagnosis was. And as you've emphasized in your work, it's sort of like Lyme disease, mold, Bartonella, and even COVID. And COVID just opened our eyes, are all the underlying layers that stimulate the mast cells, which are really this primary immune defender cell. It's not the cell for allergy patients. We all have this cell. It's important to protect us, but when it's in a hyperactive state, a lot of bad symptoms happen. So, Do you think that like a lot of these multiply chemical sensitive patients are really just, they were not diagnosed as mast cell activation? I mean, would you kind of retool that or not necessarily?
Yeah, I would say that they have. First, the answer is yes,
Okay.
but it's yes and, which is mast cell activation is intimately connected to the two things we talked about before, which is limbic dysfunction and vagal nerve dysfunction.
Right.
All three systems are totally interwoven in terms
Yes.
of how they react. So you can help these sensitive patients by doing any of those things, but you can help them better if you do all of those things. Because I've had patients with mast cell activation who are so sensitive, they can't take the supplements they need to take to get
Right. You have
better.
to stabilize that. That's what I learned from you. You have to stabilize
Exactly.
that.
So they have to do limbic and vagal retraining first to get safer, and then they can take those supplements and then they can improve. So, in fact, there was a recent study done by Larry Afrin and um, Claudia Miller, who's been very
Yes.
prominent
Right.
in chemical sensitivity work,
Yeah.
um, and and their colleague. It was recently published, I think just last year. Now, Claudia Miller has been working with chemically sensitive folks for years, and it was not until she understood mast cell activation that she went, oh,
Mm.
that's what's happening here.
Yeah.
But
Yeah.
she hasn't, forgive me, Claudia, but she hasn't gotten the really big picture yet,
Mm.
which is limbic, vagal, mast cell are what I call the trifecta of
Mm.
sensitivity,
Yeah.
that all three systems need to be treated. And
Mm.
here's the good news. We can. We have treatments for all three systems, which are extremely effective in helping them not only feel better, but you then have to look at what is triggering the mast cell activation in the first place. It doesn't just spring up unnoticed.
Right.
Um, 70 plus percent of our Lyme patients, 70 plus percent of our mold patients have it. So mold and Lyme are triggering it. COVID is triggering it.
Yes.
Other infections can be triggering it.
Right.
So it's in the mast cell field. Many clinics just treat the mast cell activation by giving medications and supplements. Okay, they'll feel better, but they'll be on those for the rest of their earthly life if they don't treat what's triggering it.
Right.
So, my take home message, which I've been working on for a while, as you know,
Well, you
is,
got it down pretty well, but okay.
is figure out what's triggering it,
Right.
and now we can cure it. You
Right.
don't have to be sensitive chemically for the rest of your earthly life. You can get
Right.
it fixed. And I've had hundreds and hundreds and hundreds of patients who were so limited chemically, as you said, that they couldn't leave their home.
Yeah.
So
Yeah. I mean,
now they can do anything.
yeah.
I
You
had
have
a
stories in the book about this, which are really so nice.
I do. I In my book Toxic, the last story in the book was a young woman I had worked with who had been so sensitive to light and smell and everything that she lived in an essentially a dark room, wearing sunglasses, unable to get out, and she'd been there for 7 years.
Oh my
And
God.
then,
Hmm.
and then we slowly got her into limbic retraining with Annie Hopper. She began to become less sensitive. We began to do some vagal work. We got some mast cell activation done. Of course, she had mold toxicity. Almost everyone there is got the mold out. And she sends me a Christmas card every year, which is a picture of her literally in the sunshine with
Oh my
no
God. Oh,
sunglasses,
geez.
dancing around, and she has her life back. And so these
Yeah.
are not unique stories. We can help these folks.
Let me ask you one last thing before we kind of wrap up. When I was reading your section on EMFs, electromagnetic frequencies, I started to think to myself, oh, I've had a couple of patients with that, and it's almost like unbelievable. And in our world with Wi-Fi and cell phones, like, what do we have these people do? They have to go to the Amish country in Pennsylvania, or I mean, how do we get them better?
Sometimes they do when they're really severe.
Really,
But
I was thinking about it. It's like, where are you going to go that you don't have a telephone, a cell phone, and a TV and computers?
there's EMF sensitivity has increased exponentially
Yeah, well,
in the last
5G.
few years.
Yeah.
When we moved from 4G to 5G, It wasn't an increase in one, like 4 to 5. It was an increase of 1,000-fold increased exposure to
Really?
electromagnetic
Wow.
frequencies. And
Wow.
now people are bragging about, oh, we're going to have 10G now. And I'm going, ah,
Yeah.
the when people become sensitive, EMF sensitivity is a part of the deal for many. And if you to know what that means for listeners out there, that means if you are using your computer or your cell phone or your laptop or your iPad or whatever it is, after a short period of usage, you may get numbness and tingling in your hands, headache, brain fog, cognitive impairment, fatigue
Mm,
immediately, and it doesn't go away.
mm.
It stays, and it's directly caused by your EMF exposure. Here's the good news. You can measure it. There are very cheap devices you can get on the
Really?
internet.
Oh, wow.
There's, there's what's called an electrosmog meter, which you can get from Amazon, less than $200. And it has 3 settings on it to measure EMFs in 3 of the major ways we can get it. Because EMF's not one thing. You can
Mm-hmm.
get it from electrical devices, which produce a magnetic field. You can get it from cell towers. You can get it from the devices in your home that everybody has and uses, forgive me, to excess. But you can measure it. You can put this device right up against your body and you hold it right there where you are with the computer, and you can see, okay, what am I getting? And it will read it out both in color and in direct numbers. So if it's green, you're cool. If it's yellow, maybe not so much. Orange, red, well, now we're talking that we have significant. But you can shield almost all of these devices as well so that you're not getting that kind of. Now, if you happen to live in an apartment building and there's 5G all around you, and there are smart meters on the outside of the building, and you've got cell towers up the wazoo, then that may not be sufficient to protect you. But
Yeah.
again, this is still a limbic vagal sensitization. Treating that will help. Blocking EMFs to whatever extent you can will help. And for some people, you may need to move to the country.
Yeah, I was going to say going into nature. I mean, I know you mentioned it one time because I've heard I knew some European people who always practice regular grounding. Walking in the grass, holding onto a tree. It sounds insane, but when you really think about it, it's probably not. I think it was Aaron Burr, not Aaron Burr, Dr. Burr, who was like a researcher on electromagnetic radiation like 30 years, 40 years ago. He used to talk about. He wrote a book about this, basically saying. And this was before any of any of the iPads. That going out into nature is about your only antidote, to the electromagnetic radiation that you're getting from even at that time devices and stuff like that.
Yeah,
So.
there are some things that will block it. If folks are interested, there's a really nice book by a French Canadian named Nicolas Pinault, Pinault, he's got a snarky sense of humor, and he calls his book "The Non-Tinfoil Guide to EMFs."
Mm-hmm.
The first half of the book talks about the known, documented problems with EMF, which are increasing. They are now, despite the fact that AT&T and Verizon will tell you how wonderful all this newest, highest toxicity
Mm-hmm.
translation 5G is going to be for you. There
Mm.
are hundreds of papers published by scientists showing that these things have physiological effects in the body and they can make us sick,
Okay.
depending on your own sensitivity. And the
Okay.
second half of the book, Nicholas lists for each device different ways of shielding the device so that you can minimize your exposure. And then again, if you've got your little meter here, you can hold it up and go, okay. For example, I've been aware of this for a while. I have a meter, but I didn't think about the fact that I read my iPad on my
Stomach.
lap,
Right. Your
right,
lap. Yeah. Yeah.
right,
Yeah.
right here. And so I got my meter out, and oh my God, what I'm getting here is way too high radiation. And
Wow.
um, so I have a shield now for all of my devices.
A shield
And
that goes over the front cover of
yeah,
the.
yeah, you can buy them from Amazon. It literally, it's a shield that goes around the device so that it blocks the EMFs that are
What's it called?
coming
Is it
into
called
your
an
body.
EMF shield? I'm just
Yeah,
curious. Yeah.
yeah,
Wow. Wow.
yeah. and it works.
Wow.
I mean,
You always have these cool things.
I don't make any of this up.
No, I
have
know. And you don't get any money for recommending
I
that.
have two chapters in the new book on EMF. One is written by Magda Havas and Rena Bray, and they are experts on EMF sensitivity and reactions. And I have one which is more complicated. It's more for physicians. It's by Martin Paul, who's a biochemical researcher who has figured out the exact biochemistry of why EMFs are affecting us in the way that they do.
Right.
And it
So
has to
that was
do
a tough chapter. I remember I saw that one.
yeah,
Yeah.
it has to do with complicated things like voltage gated channels
Yeah.
and how EMFs affect it. But again, I put that chapter in because I've known Marty Paul for a long time, and he's adding science to people's concern of, oh, again, you're too sensitive. I
Hmm.
don't know why you're reacting to your cell phone, but
Yeah.
I'm not. So
Right. Right. As we're wrapping up, I wanted to ask you, you have done your part in your career training hundreds of physicians and healthcare professionals to become more educated on these complex, highly sensitive patients. What work still has to be done? What's your next project?
I think we already know a lot about how to help our patients. And my greatest frustration is with my medical profession colleagues who don't know what I have learned, meaning they need to know more about mold toxicity. They need to know more about Lyme disease. They need to know more about EMFs. They need to know that these are very real and very common. I would absolutely promise any practicing physician that you already have in your practice people who have these conditions, but you may not uh, be conscious of it. It's not risen to consciousness. So
Right.
from my perspective, my biggest task, which I work on constantly, is changing medical consciousness.
A great line that someone had passed along to me when I first started medical school, and I've thought about it every year. It was from the great Louis Pasteur, and he said his quote was, "In the fields of observation, chance favors the prepared mind." And when I thought about that a lot, and it's basically what you're saying is, that's why I always used to study atlases, and I'm always trying to read, because if you're not thinking about it, if you haven't seen it, it's not going to just like smack you in the head and say, I know what this is. So that's why your book is so special. Just as we're concluding, I want to mention that I wrote a review on Amazon that I do think this is going to be a classic in the field of functional medicine. So privileged to know you and train with you and care for patients with you. And I hope any of the listeners who suffer with a complex medical condition and feel that they are alone on this journey, please get this book, The Sensitive Patient's Guide to Healing. Did I say that right? Yeah. Sensitive
Close.
Patient's Guide to Healing.
No, the Sensitive Patient's Healing Guide.
The Sensitive Patient's Healing Guide. I said it wrong that first
Close.
time. Okay, please
Close.
check that carefully. As we were joking before we came on, I told Dr. Nathan, I said, I've been desperately wanting to get the print copy because I don't want any EMF radiation, but I didn't have time. So I purchased it on Kindle, which you can get, and hopefully you can get it in any available bookstore. It's worthwhile for any patient and any practitioner. So thanks for listening. And next week, actually, please hang in there. We have another really good podcast with Dr. John Capellelli from Penn. We're going to be talking about the doctor-patient communication and how it could get better. So thank you, guys.